as if they're going to write an examination, it's a pass or fail thing, their pressure might go up. So not everybody's pressure goes up. Some people's pressure goes up, some people run just the way they do.
What do they call it? The white coat?
White coat hypertension. White coat hypertension. So nowadays, the protocol is that we don't look at just the pressure in the office. We want patients to bring their own recordings in. So that if the recordings at home are typically wonderful, why should we even touch it? Why should we even touch it with any medicine? You're running smooth, we let you flow exactly as you want.
You know, I find it interesting that on your slide there, you're saying the normal blood pressure is 120 over 80.
Mm-hmm.
When I went to school, that was the normal.
Yeah.
Now, you know, they're saying, well, the normal blood pressure is 100 over, 70. And if you don't meet 100 over 70, then they want to stick you on some medication. I don't agree with that.
See, it used to be 140.
I wasn't that old.
Come on, in my time, when I graduated med school, 140 was the cutoff.
Really?
You
Okay.
can do it, Carol.
The 120 standard came about maybe 4 or 5 years ago, that's it.
See, and it was just about 5 to 8 years ago when they got lower.
Yes.
You know, they wanted 100 over 70. You know, it's like, get out of here. You know?
We don't want it to be below 100.
Okay.
So above 100, we know that when we have brought the pressure down below 100, not by natural means, but by artificial medication means, we've actually caused more harm than good.
I will tell you that's the truth, because mine runs 120,
Which is wonderful.
and the doctor, well, sometimes it goes up to 130. You know, the doctor got me down to like 102 over 68. She was jumping for joy. You know what? I was so weak I couldn't even fold a towel. Seriously, I'm not lying. I'm not trying to be funny. I couldn't even fold a towel. I was so tired and washed out.
So over-medication
Yeah.
is a problem with so many conditions.
I think the problem is that they look at numbers and they don't listen to the patients. How are you feeling today? And you say, well, I can't fold the towel because I'm so damn tired. Well, maybe your daughter can do the towels for you. No, listen to me.
Yeah, low blood pressure is as good as saying that I have this lawn that I need to water, but it's just trickling.
Yes.
You want to nourish our brains, our hearts, our kidneys. At the end of these blood vessels are very tiny blood vessels. They need to be perfused with blood. So if you actually reduce the pressure so much, that pressure is not going to be enough to push the blood through to your end organs. So it's as bad as having very high blood pressure, because when you have very high blood pressure, the arteries are closed, your heart's not able to push it through, and you're not going to get the kind of nourishment that your end organs need. So this is why I pulled up this slide. This is a good one to see, the normal blood pressure is considered to be this. This is a good place to be. It's perfect actually.
Now, excuse me, what's the normal, honey?
About they usually tell us to keep it below 140 over 90.
Oh, wow.
Yeah, but it all depends on what other conditions you have. Like if you have any kidney dysfunction, or if you have any heart issues or heart attacks from the past, or if you had a stroke in the past,
Or you
then
got kids.
You know what you can't get, and this is at the hospitals. The nurses, I tell them, honey, you didn't use the right cuff. Look.
yes, yes, you're so right.
And then they go, okay, you're right, and they walk out. And it's like, well, what was my blood pressure? No, don't worry about it, you're okay, and they walk out.
I find that is one of the reasons why blood pressures are elevated in doctors' offices is the staff. They don't listen to you, they don't ask you if everything's okay, they don't pay attention to you, you're just a number. And that drives my blood pressure sky high. It really does. If you've got good staff who pays attention to your patients, keep them and pay them well. If they just want to get the patient in and out, get rid of them. Because it's happened time and time again that the staff causes more problems than the patients came in with. And that's the truth, because there are several offices where I could just have slapped the office staff, you know. It's incredible that they've got this job, but they're not doing it. They're not doing it.
See, now in Dr. Singh's office, right, they used to have the cuff, but the last time I went, it was
The wrist
the
one?
wrist, and I said to the
Yes.
gal, ooh, how come you do the wrist? He said, that's it, this is our policy, we got rid of
Yeah,
the cuff.
yes.
Well, what would that cause that to, I don't, that's why.
There is a certain amount of circumference that has to be present in the bladder of the cuff. Inside is an inflatable bladder. And if that inflatable bladder does not cover more than 80% of the circumference of the arm, it will not tighten up adequately and numbers will show up wrong. So that is why that will create a confounding factor.
Now, is it bad when it's too tight? You gotta go, ooh, take it off, it's too tight, right?
The automated ones sometimes go too tight because they can't hear the pulse. As they elevate the number, as in the pressure, they have a little mic inside that is listening. And if that mic cannot catch the sound of your artery, that pressure is going to keep going up and up and up until it actually hears that sound, or it reaches a cutoff point and then brings it down. So nowadays though, the newer machines that we use, they have something called an oscillometric means, which means they have a small recorder and they will listen to the sound and revise it. So it is not just, did you hear it now? No, it goes back and forth, and listens to the entire spectrum over time so that it's much more accurate.
That's interesting.
That's probably why it goes up, sometimes like it go down and then go back up again.
Yes.
So when we get stressed looking at, like my patients will think, oh no, it's too high, but it's just trying to figure out where the pulsations are and come up with a good number. So
Like my watch takes my blood pressure.
Is it accurate?
Yes.
Yeah.
Yes. Amazingly.
She was talking
See,
about
and-
that the other day.
And we are not talking about absolute accuracy, because we're not going to be obsessed by the number. We want just a range. And is it within that spectrum? Ballpark figure is right or not?
Then why do you want to know it 24/7?
There is a very nice thing that I bought it because I wanted my patients also to be able to experience it. If you wear this at night as well, as it continues to check your blood pressure, we want to see that there is a drop in your blood pressure at night.
When you're sleeping?
Imagine a cuff that tightens and loosens and tightens and loosens will break your sleep.
Yeah.
This one doesn't. So there is definitely an advantage to get an insight. Now, people who do not get that drop at night, they have twice the amount of chances of dying compared to those who have that settle down at night. So we want to see what
I'm
exactly.
going to die.
That's a guarantee. How fast, how likely you are, well, we'll have to look.
You wear it all day.
My blood pressure's fine.
You wear it all day? Doctor, you wear it all day?
I wear it all day. I keep it on.
because it tells you how much you've slept,
It doesn't
what your oxygen
squeeze.
levels are.
It doesn't even
See,
squeeze
I can
my
never
wrist.
do that with the treatment. If I see it's a little hard, that's when I go away.
See, I don't check it all day. I might wear it all day. See, my main motive for this was to check do I drop the pressure at night or not? And the answer, it gave me the answer. But this also counts my steps.
It also has an EKG, so patients that
Yeah.
Are they
have
costly?
issues with.
Are they expensive?
This one cost me $3.
No, sure.
Not bad. Yes.
Thank you.
I thought it did a better job than the Apple Watch.
It does. It does be more than the more expensive thing. So you have to know what to buy. What to buy, what are you looking at, what your interests are. Because when you look for one thing, the internet can give you 10 different choices and you don't know which one is worth it. And that's when I say, okay, I'm going to try this. And it's worked just fine for me. Here it is, measuring my pressure.
Thank you.
What is your blood pressure?
With you all around,
His heart is racing.
125/68.
Are we going to believe that?
Here
I like these two.
we are.
And it also tells you how much he's walked,
My
steps,
steps.
this and that. So it tells you, it's good to monitor his physical activity that way a little bit. So
Yep.
it's-
Yesterday I had about 18,000 steps in. It's wonderful. You know, the day before that I had about a similar amount. I like to play sports. So it tells me, did I work out adequately or not? Not that I would change my activity. I do, whenever I go to play sports, I want to feel exhausted by the end of it. And if I don't feel exhausted is when I go back to this and say, hey, did I do enough or not? And if it says yes, it just tells me that my workout capacity is improving.
Okay.
So this is what, you know, there are small things that sometimes it's just curiosity. It may not even have an impact on my life. I may do nothing with it. You know, like, let's say if I am 5 pounds overweight, I might be doing nothing about it. I'm comfortable with it. Now when I go and see a doctor, she might tell me that, hey, this, you know, you need to get rid of this. Central obesity is really bad. And I might at that point say, yes, I gotta do it. My doctor is telling me I gotta do it. So sometimes these pieces of information come in handy at a completely different time. For instance, if you know something about yourself and are not doing anything about it, but you know it, the doctor will see the same thing that you know and will just have to say a few words and you will say, I'm on it. So these are the types of things that more information is better.
I ran a subnormal blood pressure, like 90/60 in my left arm. And I was told that if it got below 60, that I needed to call my cardiologist in Hudson immediately because there was going to be problems. But I got down to 56 and I felt fine. I was walking around the house and I did a clinical workup of myself and I said, awake, alert, oriented. I'm not falling down. I'm doing everything I can do. And I'm talking on the phone. I'm not calling him right now. I noted it and I brought it to him and he says, why didn't you call me? And I said, why should I have bothered you when I was doing everything that you would have asked me about? And he said, nurses are the worst patients.
I was going to say, now you know who the second nurse is.
But
They are terrible patients.
yeah.
And
As are
doctors, not just nurses.
Doctors are worse
Doctors.
too.
See, we know so much about medicine that we try and downplay our problems. Isn't it?
Yeah.
That's true.
This is
I
fine.
can take care. Well, I had an MI and I didn't know it, so.
Yes.
But the other thing is, with the blood pressure cuffs, I have a lot of flesh here. Okay. If you try to put a regular blood pressure cuff on my arm, it's going to squeeze and it's going to hurt and it's going to shoot my blood pressure up. And I will always tell them, do you have a large cup? Well, you don't need a large cup.
There you go.
Hello? Yeah, I do need a large cup. And I'll say,
See, I think this might be the reason most practices have gone to the wrist ones. And it does much better. It's more standardized.
I have a wrist one in my house and it's wonderful.
That's it.
But is that the problem, like in the hospitals, they don't have a large cuff? Or, excuse me, are the nurses
No, they have it.
lazy to go get a large cuff?
See, the workload can be so much. Sometimes it is a tech who's doing your blood pressure and not one of the more qualified nurses.
It's the one.
And they
Exactly.
may not have the professionalism to go on to the next step. I'm sure they're working hard, sometimes harder than they need to. One just has to accept that this is what's happening, and the next one around might do a better job. They're checking you so often, so many times, that within that period that you're there, somebody's going to catch what's going on and decide whether something needs to be done with it or not. I mean, a blood test every day, blood pressure every 8 hours. Who does this? We only do it in the hospital, even when it's not related to it.
You do blood work every day?
Especially when it's high, you check it. She told me to check it every 4 hours.
We guys, in our practice, we say, don't get obsessed with this number. Let us be obsessed with this number when you come to us. Or, when it's terribly high, let us know, we'll make some changes. But once you get obsessed with these numbers, people who want to go and check their weight every day, or twice a day, or 3 times a day, what are you going to do about it? So these types of, plus we know that in the morning, your pressure is going to be higher than it's going to be in the evening. So there are diurnal variations that will make you worry. We don't want that. We want you to live a normal life. You're doing good. We bring you within a safe range and make you safer and better over time. And that's the right way to manage blood pressure.
Yeah.
If you go to the hospital for an emergency high blood pressure, all they need to do is drop it by 10%. Remember that balloon concept I said? Same thing. Drop it by 10%. Balloon's not going to burst, send them home, and then their doctor can take care of it.
What's the worst thing that you can do to yourself if you have high blood pressure? The worst thing, whether it be food, exercise, or whatever, what's the worst thing that you can do for yourself?
Drink alcohol.
Drink alcohol.
Yes.
I don't do that. I really
Yes, because alcohol is one of the most powerful lifestyle blood pressure alterers.
Is that true?
Yes.
How come when
In
you go
the short term, of course we have weight in the long term, but you can't change anything there. But in the short term, you doing something wrong is that continue to drink alcohol.
how come when you go to the doctor, he gives you 3 and 4 blood pressure pills to take instead of just 1?
It's a very nice question. Your doctor is doing a good job. Because as we give a little bit of a medication, it gets you most of its benefit. As we start to increase the doses, the benefits don't proportionately increase, but the side effects disproportionately increase. So somebody who gives a squirt of this, squirt of this, squirt of this is actually doing a great job.
Also, blood pressure doesn't...
Does that make you feel better about
A
what your
little
doc's
bit, yeah,
doing?
because I'm on 4 blood pressure pills.
Doc's doing a good job. We can blast on one. That's not what we want. If we have 4 speakers out there making a difference in the environment, we want each one turned up slightly as opposed to one raised up so high, because it's going to have side effects.
Plus, each of these pills, they work differently. They attack the blood pressure in different ways. So he's just trying to make sure that every
Mechanism is
mechanism
utilized.
is utilized, yeah. So instead of increasing the width of your blood vessels, he's trying to make sure that you excrete some of the sodium and water that's in there. So different medications, and depending on what your other conditions are, some medications work better than the others, and they improve your lifespan. So this is a question that I get asked a lot, like, why don't you just put me on one pill? And I wish I could do that. But sometimes they have combination pills, so that way they can reduce 4 pills to 2 pills, you know, because they have just one medicine that has 2 medicines.
Yeah, so that's what she said, you know. So maybe combining the pills. Instead of taking 4 pills, then you might need to take 2. Each one of those pills has 2 medications inside.
Yeah, right.
To make it easier, that's all.
Now, would that cause your ankles and feet to swell?
One other type of medicine, very much. Amlodipine.
That's what I take.
Yes, very much. So when that becomes a problem, then we change it. Otherwise, it's a good drug.
It's a good drug. Yeah.
Mine did that until they changed it.
Yes, change it.
I take 2, one in the morning, one different at night.
Great. And amlodipine is best taken at bedtime in case you're not doing that. Okay? Lower side effects, less ankle swelling.
I take amlodipine first thing in the morning.
So there you go, flip it. Flip your timing.
So keep it in the morning instead of at night? Or
No, night.
take it at night?
Most blood pressure medicines, if taken once a day, are best at night except for water pills. Okay.
So anyway, these
Well,
are the
that's different.
stages.
First time I've ever heard that.
Now you know.
Yeah, but doctor, you can't just say, oh, I've been taking mine for years in the morning. You can't switch tonight then, can you?
There is a pattern how we change it, and there's a reasoning behind it. The reasoning behind it is that the highest blood pressure that the body and heart generate are at a time just before we wake up. You know, when you start a sleeping car is when the highest amount of energy is used. Same thing with our bodies. So if we want to protect against that surge, what do? We give the medicine before you go to bed, so that extreme surge doesn't take place when you're waking up. So we protect you against multiple things by requesting you to say, hey, nighttime is the best time, except for water pills, because you don't want to be out there in the restroom all night.
I am. He tells me to take my water pill first thing in the morning.
Okay,
But I'll tell you, be very honest with you, I don't go to the bathroom all day long. My first time going to, at night, it'll be probably 8, 9 o'clock at night.
and there is a reason why. You know what the reason
Praise
is?
the Lord. Exactly.
The reason is that in the morning when you wake up, that amlodipine you take, where does your fluid go? Into your legs. In the night, you are going to bed, and your legs, excuse me for doing this, are coming up.
Yeah.
Where is that water flowing? Back into the system towards the kidneys. What do your kidneys do? They sense that, hey, there's too much water. What do they need to do? Throw it out. And you're up all day.
Yeah, I am up all night.
That's why.
So I drink all day.
So now that you know the reason, you will need to change a few things so that that night side effect doesn't take place.
Take it at night. Interesting.
Alison, offer her one of my cards. Say, man, these guys know what they're talking about.
So these are just the stages, you know. It's easiest to think that, you know, trying to keep it below 140/90. That's stage 2. Above that is hypertension, of course, but stage 2 is 140/90. Between 130 to 139 is stage 1, and of course elevated is above 120 to 129, with the lower number less than 80. But normal pressure 120/80 is perfect pressure to be at. So I think I'm going to just skip the next few and go to the this one slide that I like, this one.
Yeah. Can't see it.
Can't see
Forget
it.
Yeah.
You don't see it, make an appointment, okay?
Well, these are, yeah, I know that you have good physicians that are handling your medications, okay, but I think that what you guys could do to help yourself is, you know, do these things that can be done at home, like weight loss, exercise, etc. But I looked at this, and apparently the strategy that causes the most drop in your blood pressure by about 11 millimeters is a healthy diet, something called a DASH diet, which is a low salt diet, and
Mediterranean type diet.
now because you are here, I think somebody else is cooking for you. Is that correct? Is there a chef that?
No, we cook
Oh,
ourselves.
you cook yourselves. Okay.
We wish we had a chef.
So more fresh vegetables, fruits, whole grains, low salt. This is the type of diet that you should think of.
Full, yeah, whole grains and you know, fruits, vegetables, less of canned food.
Shop the borders of the store.
You're right. Don't go in the center.
Yeah. Interesting how, you know, things are strategically placed so that we pick them and walk out with what we did need.
And then you're gonna cross someone like me who can't eat fruits and vegetables.
Yeah.
Do you have diabetes? Is that
Yeah.
No, I had colorectal surgery for cancer,
Oh.
and one of the effects of that, I wasn't warned about ahead of time, was, I can't eat fruits and vegetables, just.
Yes.
I took that second with potatoes and bananas and.
So what do you have? You have short bowel syndrome?
You have diabetes.
Yeah, there's this much between the end of the rectum and the, well,
You know, there is a medicine that slows down the gut motility and creates weight loss.
I think I like you.
Yeah. Me too, Sandy, me too.
The medicine costs about $1,000 if I write a prescription.
I don't like you anymore.
See, all things from through our office, it costs way less. For our patients who are on HMO, some of them who can't afford it, we even inject it to them for free. So something to consider that, hey, are there options for me? The answer is yes.
What is the name of the medicine?
Ozempic.
Ozempic. That's what they're advertising a lot.
Yes, whatever they're advertising costs a lot. Just
Yeah.
remember that.
Yes.
On TV, what's on TV means they're going to gouge you for $1,000.
Wow.
But it doesn't mean that a physician's office can't be smart enough to get you something that's similar or exactly the same chemically for less. That is key. Anybody can do a job. You know, anybody can build this house, this building, but the guy who can build it at a wonderful cost as well is the one that you want to hire.
Right.
Same thing in every profession. Anybody can fix a car, but the guy who can do it reasonably is the one you want to hire.
Yeah.
Because the one who does it reasonably, even if somebody else is paying, it still makes a difference to the entire system.
Where are you located?
Right here.
You're gonna come here. To my liver.
Do we have cards?
I was gonna pass them out at the end. Do you want me to
Oh,
pass
okay,
them out
we
now?
can get them at the end.
We're right on Mariner, next to Springstead High. Do you know where Springstead is, the high school?
There's Murphy's Market right there.
Right beside that.
Yeah, just at that corner.
Give them the attendance sheet.
Oh, yeah.
So, yeah, that seems to be,
Oh, I'm coming.
what, do you have any?
Thank you.
Thank you for making me feel good.
I have a question for you. What happens if you're a diabetic and you have high blood pressure?
If you're a diabetic and have high blood pressure?
Yes, and I have COPD too. Because I smoke.
I'm sorry, what was that?
Her question was, what happens if I'm a diabetic and a hypertensive? Let me just wait up to
Our main focus is not crisis management. Our main focus is prevention. So that you don't get into a crisis. Right. And those options, one has to plug so many holes that it's not easy to give people right now for all three conditions. But you come have a consult, you guide you exactly what you want.
All right, it says award winning. Now, what award did he win?
Exactly.
So he is very academic and he won these, I guess it was a national contest for medicine like, as a resident he won all these. And then now he's also won a lot of awards with the insurance. So I'll let him explain exactly what he is.
He sells the most insurance of any doctors in town.
Oh, okay. Well, they're all cheap.
Yeah, he loves to participate in all these
I do
academic
this,
meetings
and I have a machine for this too.
But she also smokes.
competitions and things and
So this is
there's a lot of
we guys as
change.
physicians creating a problem.
Oh.
Like Jones, we are. We are creating a problem. And then go ahead and the water comes back and goes.
5 times.
Yes.
Gaurav, they wanted to know what awards you
Well, I
won.
done burn it down.
What awards
I
I've
put my
won?
whole box down.
My wife has stayed with me for 25 years.
You have a wonderful wife. You have a wonderful wife.
My patients have stayed with me for 20 years. since I started here. The first patient I saw in the hospital is still my patient.
That's nice. That's good.
So
To be honest, I am looking for another doctor.
it is such a fine feeling. Whenever I see him, his family, he came to me one day and his daughter called and said, "Doctor, I have some spots on my legs that have gone." I said, "Okay." I asked her, "Have you had a sore throat in the last couple of weeks?" She said, "Yes." I said, "I want you to come to the office, give a sample of your urine for me." She gave a sample of the urine, and there was an indicator in there that told me that her kidneys are failing. All from a rash. But it is about being astute at the right moment. And the right moment might not come for 10 years. But it's that same family that my first patient in the hospital, his daughter, I got her, she didn't have any insurance. So I called up one of my kidney doctor friends who I send all my patients to because I trust him. I said, "Buddy, can I send this patient over? Can you see her? See, I think this is her diagnosis." She went over, diagnosis confirmed, she started to get treated. But these are the types of things that I enjoy. And say, this is what we've read in books actually is happening right here. So I have one, the best graduate of my med school. I have one, the top scoring graduate of my residency program. The top 3 doctors in the United States in medical quizzing. And it wasn't just US alone. It was US, Canada, and Mexico. It was a North American contest. I won gold medals in multiple subjects. I won silver medals in multiple subjects. And I am the best athlete of my college. What? Yes! Somebody told me that everybody loves the food. They do.
You're not a fool.
But they, but I think I get as a professional, I get my love. From my colleagues, I like to earn their admiration. One time I was just sitting with a doctor, she's a local doctor, and she told me, I have this really weird patient. He keeps coming to me with ankle pain. I said, "Okay." I said, "Does he have any diarrhea?" She said, "Yes." I said, "Have you checked for this?" "No." I said, "Check for this." She called me 2 weeks later. She said, "Diagnosis is right." So it is nice to earn the respect of your colleagues as well. When you work and they know, when you go to somebody and you say that I went to see this guy, and they would say that I don't think I could do better. That is the type of person you want to be. So, and it gives me a lot of fun. I teach my own sons that that knowledge is the best thing you can fill your life with.
How old are your children?
We have twin sons.
You didn't go by yourself.
I did all the work.
I think they're mine.
Let's follow the reason at their door.
Who's your best kidney doctor, a boy?
No.
Okay.
When time comes, I will guide you to the best guys.
And your children are how old?
25 and 25.
Who are you? Wow.
Yeah. So I have 2 25-year-olds and one 16-year-old.
Oh.
Oh my God.
They get better when they get older.
They are. It's a nice feeling to be with them. One is going to med school in Miami now, and the other one works in Tampa in a financial technology company, and the third one is still
Making up his mind.
waiting to
Very
go.
nice.
Very nice.
Are there facilities here for physical activity? Do you have a gym and things?
They do have a gym.
Yes, we do. It's on the
Unused.
second floor.
They used to have a trainer, it doesn't come anymore.
There's treadmills up there.
So we do have in our campus, we do have a gym with a personal trainer and For those people who don't want to do it, we also have a machine that you can just lay down and it will exercise your body.
You can fall asleep.
Yeah.
So there are, see, after all, we have to look for options for every kind of human being. We're not just saying you're in the army, this is what you will do. We're in the civil. I didn't join the military for this very reason, that you have choices. You know, you have freedom. You have true freedom rather than a commandant always telling you what to do. You have true freedom to do so many things and still keep people well and happy. So I think we have multiple options. That hey, this can be done, this can be done, this can be done. You want to pick one of these? No. And I understand, you don't want to pick any of these. At a later date, you might change your mind, but you will know that all these options are there.
Do they have a pool here that you can get into?
A pool?
No?
Only when it rains heavy.
Access to one.
Okay.
Yes.
Do you guys go to the Y? I mean, what kind of physical activity do you manage to get?
It's upstairs, a bicycle, treadmill, or something else.
And an elliptical.
And dance whenever I come give a lecture.
Basically, we sit around and we gossip a lot. Our brain's working.
And we've got shuffleboard, and we've got a grill out there, and we've got a library upstairs, and we've got a computer room upstairs. And
Anyone can walk around the building, we do that.
yeah, we walk around the building,
Beautiful.
so we just walk around the building.
A lot of us have pets that we chase around the apartments.
Yes.
Amazing.
They keep you happy, I'm sure. That brings the pressure down. for
That
sure.
does, it really and truly does. People need animals,
Yeah.
they really do.
And there's activities, Edie makes sure that there's activities going on for us.
We have game day.
We've got the best resident manager.
Which you do.
We really do.
He's just making his little comments.
What do you say?
He said he's your animal.
Oh my gosh.
That's all right, she's gonna get even with him when they get home.
You put me in a leash, I think.
Yeah, we literally put him on a leash and brought him today. He was just walking by and we're like, Johnny, go to the bar.
They brought me here.
Yeah, we have
It's
all
nice
those
to
things
see
upstairs, but hardly anybody
You
ever
guys
uses
are
them.
laughing.
Yeah.
That's a big plus.
That's true. No one uses them.
Right.
All the machines upstairs. I've never seen anybody go in and use the treadmill or the bicycle or anything like that.
Some lady
Most
fell
of
out
us-
a few years ago, cracked her head open.
You know,
Most of
we-
us are in walkers or wheelchairs or got this ache pain and that ache pain.
Bad for your
See,
ankle,
exercise
joint.
bike,
So there's
sit down,
a
They
sitting
have one
bike,
up there.
that's what our
Come on.
Yeah.
even a few pedals, it improves coordination so much. The exercise bike, it is good for people with Parkinson's. These types of things you must incorporate in your life.
Well, you know,
I walk.
what you could do is, since you're a nice group of people, you could just put on some music and have a nice dance.
Yes.
You know, that is,
By yourself?
it would be so
I want Barbara.
lovely, like it really regenerates the mind, it really makes so many electrical connections again in your head.
Have you met some of the men in this building?
Yeah, where are they? We like.
Yeah, where are they?
We try to keep them hidden.
They didn't come last
I always
time
thought this was
either.
women's
They didn't come
only
last
facility.
time.
Yeah.
Just women.
You know, they say girls have more fun.
We do.
So you girls together can organize it. As nurses, you two can lead. Both of you are nurses, correct? You two can lead. You can lead a health program.
You can
And
just put
do
a
something.
video on or something and just, you know,
You have so much knowledge. You
what
have
I'm
so
trying to
much
see
wealth
is
of knowledge.
how
Must-
you could help yourself in this situation. Like, you know, with cooking, of course, you know, you're cooking well, I'm sure. You could avoid getting things in cans if possible, as much as possible. Try to use less salt. And there are medications, over-the-counter medications that can increase your blood pressure. But apart from that, exercise is crucial. Exercise and dance and socializing, bring your pets somewhere where you can all enjoy them. I think these are things you could do here to help your blood pressure. And of course, along with that, there are other, like you mentioned, blood pressure and diabetes. These are all risk factors for cardiac or a stroke event. So we always focus on trying to get these things well controlled. Of course, medications are there, but before we get on to medications and the side effects associated with medications, we try to work on weight loss and other methods like this, like to take salt under control, not to take anything over the counter, making sure that your thyroid is working okay, your cholesterol is okay. So these kind of things, they bring down your risk for the stroke and coronary events, and that's what your doctors will do. But you can help yourself with these other things that I was talking about, like with pets and exercise and socializing, etc. To help other things like the anxiety that you have, that will get under control. Your memory will improve significantly with exercise. Aging will become a little better, but exercise is crucial.
Sure. Good friends are great medicine.
Good friends are such a
And
blessing.
when good friends do good things together, it doesn't even feel like exercise.
It's never exercise.
I
But
go
I'm not
out
going to jump rope with you.
Maybe some chair yoga, chair yoga and Tai Chi. Now I know that those people don't come here to train you, but it's all there online. If they can.
You're going to make me
Or-
start exercising.
or-
right there.
I
How
will
long
give you,
would we have been friends up until this minute?
hey, do you have a local YMCA here, this side of town?
I don't
think
know.
so.
I don't know.
No.
I don't know.
They do have that candlelight gym still, or they don't?
I'm
I
not
just
familiar
moved
with
here,
that.
so I don't know.
Okay. Well, we know that we are 20 minutes drive away from you. We time is 19 minutes drive. Is that? So, if you can make the drive, come. We will be holding your hand and taking your head. Because we have a personal trainer, which means you get personal time. You will be introduced to a group that comes and socializes and has a great time over there. And they welcome people who are interested in similar stuff. There's a whole lot that you can take advantage of. You didn't come here to die. You came here to have liberty, more freedom, more life. And I think you must work towards it and continue to do so. If we can be part of it, we are also blessed. If not, you must take your blessings. You should not miss them.
In your practice, do you have the facilities to draw blood in right there, or do you have to go to a lab?
We have them right there.
What else do you have right there?
X-ray,
X-ray, blood work.
blood work, bone density, lung tests, EKG, checking for a heart attack. We have the exercise, we have the gym, we have dance classes are no longer, correct?
No, there was that lady who might start one, but
Yeah? Okay.
she mentioned it, but
Okay.
right now nothing.
So we plan to have some dance classes. We're not just a one doctor show. So which means if any one of us is on vacation, somebody's always there to take care of you. You have the choice of seeing the same person, provided you're willing to wait until they've seen their previous one, or seeing whosoever comes for minor stuff, they take care of this so that you can be on your way quickly. So there is a lot that we do offer. We have 100 parking spots, 100. And they're never ever full. So parking itself can be a headache at times in places. You say, what do I do with this? So you say, I don't want to park next to this one. There is so much parking, it's amazing. So there are pluses, but I realize that we are almost 20 minutes away from you. So If you can make that trip once every 3 months, great. If you can make that trip more frequently, you will enhance your lives. I can tell you this now, you will enhance your lives. I have personally been to that gym multiple times. It changes the way a person exercises. It changes the way the comfort level of dealing with the machines, because the machines sometimes can be intimidating. You know, as things get newer, their controls change. So if somebody is there to walk you through it and watch you while you do it, it makes a difference. If somebody is there to select what machine is right for you, it makes a huge difference.
You work specifically just with senior citizens, or do you take somebody that's younger than them?
We do take younger on Blue Cross.
Yeah.
Do take younger on Blue Cross, but my practice was almost exclusively senior citizens.
I have a daughter that's looking for, and she's 53.
Would be a perfect fit for them. Is she here, local, or is she somewhere else?
She lives here in Brooksville,
Okay.
4 miles from me. That's why I'm here.
How lucky.
And you accept all the insurances?
Optimum, Freedom, WellCare, Blue Cross, Humana, Medicare straight, with supplement, without supplement.
United?
United. You do United Seniors? Yes.
If they have Medicare as a...
Medicare United or regular United?
Through AARP.
Yes.
Okay.
Are your doctors local here in Brooksville itself?
Pretty much, yeah.
See, what I tell people is, don't go to the nearest restaurant all the time. Go to, if you have the option to pick the best, and it doesn't cost much more, go to the best.
I had a situation where I made the appointment when I had my appointment, so it was like 3 months ahead. Something came up and I called and canceled 12 days in advance, okay? And I tried to make an appointment right then and there to be seen. The next appointment that they could give me supposedly was 2.5 months away. And I can't live like that.
That's a busy position then.
Which is good.
Tells me he's too busy, or the young man who took my information didn't know what he was doing. So either way, it's a loss.
For us, we have an online appointment maker. If you're comfortable with that, it shows you which ones are open. Go pick it, move.
On the computer?
Yes. On your phone, on the computer.
I can see it now. Make my appointment by computer, answer the doctor's questions by computer, pay on the computer. See you later, doc.
Options are there. See, you can call in, somebody leave a message, somebody will call you back, talk to the guy on the phone, the computer, you can do it on the computer, you can do it on your phone. Lots of, see, it is all about the spectrum. Each person is comfortable at different levels.
Actually, as a physician, during these COVID times, it was a relief that we could actually connect with our patients online. They couldn't come to us or they couldn't go to them. So we could actually call them, see them, have them check their pressure, etc. And we were reassured that they're doing okay and I can connect with them.
Well, I know
So this televisits have,
we don't have any
Just
trouble.
leave it there, I'll take care of it after.
Got it.
even though, we don't like to do them too much, but at least it helped us to connect with our patients. We could actually see them and, reassure ourselves that they're doing fine, or okay, they're not doing fine, we need to do something. So televisits sound like, oh my gosh, I'm not actually physically seeing the patient, but when it's needed, it's very useful.
And if someone called today for an appointment, what would the average wait time be before they got seen?
Depends on your need. If it is an urgent, today itself,
We prefer that you come to us and see
Routine.
and get things done right away rather than land up in the ER or the urgent care. So I often tell my patients, just when you know it's bad, just walk right in. We want to make sure things are addressed right away.
But a normal appointment time would be
Usually like
a couple of
3
weeks.
days.
let me open it,
Really?
okay?
Okay.
wish, in India when we grew up, it was, yeah, I see the doctor today. So when I came here, I was like, what? I need an appointment for what? I'm sick today. So it
And
was
sometimes that
different.
happens.
So it was a learning process for us to realize, oh, I have to actually wait for a few weeks to see my doctor? No. So that's something, we really, there are how many providers? In his office there are 4 providers in his, ours are 2 providers. So we always have somebody or the other there, so that if there's anything urgent, somebody will address it and make sure that, and after hours phones are carried by the providers too, so we know exactly what we're dealing with. We have everything on our computers, so our patients are, looked after even after hours. Accessibility, we are really, that's a very important thing for us.
Okay, so if you have a problem, you can come
You're
in quick,
reachable.
today or tomorrow. And if it's not a problem, then we can get you in next week.
I think we're going to end this talk.
I hope you enjoyed us.
We
enjoyed you.
We did, and we were not planning to talk about medications, but it's so nice that you brought those up. So now you start to understand how the principles of treating blood pressure are. All medicines at nighttime, except for which ones? Diuretics, water. Perfect.
I hope you guys learned something today, and I hope you can maybe change your life with some of these